Hi, my name is Satori Gibson, and I'm your Philadelphia Medical Reserve Corps Volunteer Coordinator, and this is your new Volunteers Welcome Orientation session, led by myself and your new MRC Workforce Specialist, Brianna Thomas. Brianna, would you like to introduce yourself?
Thanks, Satori. Hi, everyone. My name is Brianna, and I'm the Workforce Specialist for the Philadelphia Medical Reserve Corps unit. I'm happy to be here to work with you all and get to know you all as well.
Thanks, Brianna. And now we'll go ahead and get started. So before we dive right in, we wanted to give you a snapshot of everything that will be covered in this orientation session, starting off with an overview of public health emergencies, as it is very essential and important that all Philadelphia MRC volunteers know what a public health emergency is so that you can appropriately and properly respond to one if and when called upon. Next, Brianna will talk about some MRC history and some of the missions we've completed in the past. I'll then talk about volunteer training and deployment opportunities made available to you. Brianna will then talk about some MRC partnerships that we've cultivated and strengthened over the years. I'll then pick up and discuss some eligibility criteria for all potential volunteers. We'll then discuss the benefits that come with volunteering. Later, we'll talk about the volunteer deployment process and the MRC point of contacts related to those deployments. And lastly, we'll introduce some MRC newsletters that we'll be putting out. All right, so before any Philadelphia MRC volunteer can deploy to help support any public health emergent response, it's essential that you know what that is first. So what is a public health emergency? A public health emergency is defined as any event that threatens to overwhelm routine public health and healthcare activities due to scale, severity, timing, or unpredictability. The best example that we can provide for this was the coronavirus COVID-19 global pandemic that took the world by storm in 2020. And now I'm going to toss it over to Brianna to discuss some MRC history with you. Brianna?
We're going to start with some history about the Medical Reserve Corps, also referred to as the MRC. The MRC was founded after the 9/11 attack on the Twin Towers. In the same realization that there was a great need for a massive workforce nationally, it was also noted that that same need was here in Philadelphia. So in 2005, the Philly MRC unit was founded to respond to emergency disasters and large-scale events in and with when needed. Our unit is involved in various emergency responses, such as vaccination sites and clinics, community canvassing, and outreach initiatives. One of our biggest responses to date was the pandemic response in March of 2020, in which we deployed volunteers to support COVID-19 efforts until May of 2022. Overall, the MRC is an organization that is greatly needed locally and nationally, and we are happy that you've dedicated your time and services to these efforts.
Thanks, Brianna. And now we're going to talk about just how many MRC units there actually are. So here you'll see in this image is just a representation of the roughly 800 community-based MRC units across the nation. And as you can see, there are units as far as Hawaii, Guam, even Palau. So regardless of where you live, you'll always have the opportunity to access an MRC unit where you can dedicate your time and your services. And now I'm going to discuss some eligibility criteria that's essential for all Philadelphia MRC volunteers. So first things first, all MRC volunteers must be at least 18 years of age or older. All volunteers must reside in or near Philadelphia, including temporary residents such as students. And this is essentially because when we do have a large scale, whether that's a public health emergent response or a large scale event like Broad Street Run or Made in America, if and when called upon, it's essential that all Philadelphia MRC volunteers are able to readily respond and access those deployment locations in a timely manner. The next requirement or eligibility criteria being that all MRC volunteers register on our state registration emergency communication system called SERVPA. This is how we communicate to all over 7,000 of our volunteers. And lastly, we do run criminal background checks on all Philadelphia MRC volunteers before they can be admitted into our unit. And if you have any questions about any of the eligibility criteria that I just mentioned to you, please always feel free to reach out to mrc@phila.gov, and we'll list our contact information for you at the end of this presentation. And just to provide a quick volunteer snapshot for you, the Philadelphia MRC is made up of over 7,250 plus volunteers with extensive differing professional backgrounds, skills, and expertise. Now, while you see a large amount of our volunteers are made up of clinicians or clinical professionals, there is a large amount also that is made up of non-clinical professionals, but those professionals are still working within the field of public health. That is not to say that we just solely accept volunteers who are clinical or public health related. We do accept volunteers of all professional backgrounds. So you can be a teacher, a dancer, or even an athlete and dedicate your time and services to help and volunteer with the Philadelphia Medical Reserve Corps. And I'm going to toss it over again to Brianna to discuss some MRC partnerships that we've cultivated and strengthened over the years. Brianna?
The work we do here would not be possible alone. We have key partnerships with some community organizations that help us do the work that we do in an effective and efficient manner. We work with the Philadelphia Office of Emergency Medicine, and they help us, the emergency management, and they help us to transport our logistical materials and supplies to and from deployment sites. We also have built a strong relationship with the Philadelphia Fire Department, and we work alongside them in their medical tents at any large-scale special events. Lastly, we have a great relationship with the Philadelphia Police Department, and we provide them with 3 annual flu clinics every year. This helps our volunteers with clinical and non-clinical practice skills in preparation for when and if they are called upon to inoculate first responders.
Thanks, Brianna. And now to cover some of the large-scale special events that Brianna just mentioned. Every year, in partnership with the Philadelphia Fire Department, we work in their EMS and medical tents at the Made in America Music Festival, the first responder flu clinics that Brianna just mentioned, where we practice training as an exercise for our volunteers to inoculate first responders if and when needed. And then we also support the Broad Street Run. In addition to those, we provide volunteer support for the Philadelphia Half and Full Marathon and the Welcome America Festival as well. And these are all volunteer opportunities for you for both clinical and non-clinical volunteers. And if you have any questions about whether you would be considered a clinical or non-clinical volunteer, you can always email us again at mrc@phila.gov for more clarification. And now my favorite thing, we're going to get into talking about some of the benefits. All right. So here are some of the benefits that come with volunteering with our unit. So first thing is you gain skills to serve. You'll have the opportunities to both build and expand upon your skill set when you're out in the field and deploying with us. Speaking of deployments, you'll gain deployment experience. And then this is experience that you can even add to your resume, or if you need to log clinical hours, if you are a clinical or medical student, we can verify those for you as well. Next up, we offer free certifications and free CEUs. So certifications are offered for something like Stop the Bleed training, and then we also offer CEUs, which is continued education credits for licensed physicians, nurses, social workers, EMTs, and even pharmacists. Next, networking. Networking is a huge thing. Through volunteering, you'll have the opportunity to meet like-minded individuals with shared interests, and who knows where that can take you. We've had volunteers make very prominent connections through their deployment experience, through attending training opportunities that we've offered to them. And we've seen this to be of great benefit to our volunteers. Next, as a thank you, in the best way we can, we do like to give back. So we do offer certain preparedness materials, or we even give away go kits, which are essentially emergency grab and go kits that you would need if there was an emergency situation and you need to evacuate rapidly. We do also offer apparel as well for volunteers who are out in the field deploying. And we hope to offer even more giveaways to you in the future. And lastly, as I mentioned a little bit earlier, the training opportunities. We do offer you opportunities to continue and expand upon your education, build on that knowledge that you already have or are looking to strengthen with both virtual and in-person training opportunities. And we offer this to all volunteers, whether you are clinical or non-clinical. And now I'm going to go over what the volunteer deployment process essentially looks like. So first, as I mentioned earlier, all MRC volunteers are required to register in SERV PA under the Philadelphia Medical Reserve Corps unit. And there are instructions attached to that how-to email that you'll receive about how to go about registering through CERT-PA, what information is required of you, and things like that. Next, once you're registered, you'll then be eligible to receive deployment opportunities that you can sign up for. And the way that we disseminate our deployment opportunities is all volunteers get an email that'll come from either the MRC inbox or from CERT-PA. It'll always identify itself as being from Philadelphia MRC as the sender. And then essentially it's a quick link that you can just click on and you can fill out and basically make your selections as to your availability, what kind of volunteer opportunities you're interested in, what kind of training opportunities you're interested in. And this is also how we will disseminate our newsletters, which we will talk about a little bit later on. Next, after you selected a few deployments or training opportunities that you are interested in and are qualified for, depending on whether those opportunities are clinical or non-clinical, we'll then contact you with what we call a deployment summary. This deployment summary will depict everything that you will need in order to respond to your deployment and arrival on site, prepared and ready to volunteer. Next, once you arrive on site, all volunteers are asked to sign both a liability and confidentiality waivers, and I'll cover those in just a little bit. But essentially, if you're a new volunteer, you must sign both this liability and confidentiality waiver. You only have to sign it once, not every time you deploy, just one and done. And once you arrive on site, we provide something that's called a JIT or JITT, which is a just-in-time training. And we provide volunteers with all the essential information that outlines your roles and responsibilities so you know exactly what you are doing that day. And that'll be the time where you can ask any questions, especially if you are a clinician or even a non-clinical volunteer and you're just, a little eager to find out a little bit more about the deployment. That'll be the time where you can ask any questions. And nextly, we'll talk about acting within your scope of practice. We are providing separate trainings for this pertaining around scope of practice, but essentially, if you are a clinical volunteer, you are only able and permitted to do the things that are within the parameters of your clinical license. If you are non-clinical volunteers, you are absolutely not acting in any clinical capacity, which means if you're a non-clinical volunteer and you don't have a license to vaccinate, you're not going to inject someone with an influenza vaccine, or you're not going to take someone's blood pressure because you are a non-clinical volunteer. And let me just mention that even medical students are considered non-clinical volunteer and do fall under the scope of practice of non-clinical volunteers because you don't yet have that license. And again, if you need any clarification about that in specifics, please email mrc@phila.gov. Your on-site point of contact, or as we refer to it, your MRC POC, will be your designated point of contact for either that deployment or for the duration that you were in the field or on site. This will more than likely be myself or Brianna, but in the unlikely situation that it's not either of us, it'll always be specifically identified who exactly your MRC POC will be in your deployment summary. And then, as always, as I mentioned, if you do have any questions or concerns pertaining to your deployments or even any training opportunity, please always feel free to contact us at mrc@phila.gov. And now I'm going to get into the nitty-gritty and talk to you about the volunteer liability protections. So in the center of the screen here, you'll see just a quick snapshot of a legal document that essentially depicts exactly what the general liability is in terms of covering Philadelphia Medical Reserve Corps volunteers. So here are a few important things you should know. Volunteers who are actively deployed by the Philadelphia Medical Reserve Corps are in sense considered city employees for purposes of the Municipal Tort Claims Act. City employees are then indemnified and compensated and defended by the city of Philadelphia against claims to persons or properties in accordance with the provisions of Chapter 20 through 700 of the Philadelphia Code and Political Subdivision Tort Claims Act. If you have any questions about anything I just mentioned, please feel free to contact us again at mrc@phila.gov. And then just to go over a little bit about what that scope of practice is, this is just, again, to reiterate that Volunteers should only work within their scope of their clinical license and or their assigned tasks. While we do understand volunteers have a wide skill set, we appreciate that. However, volunteers must adhere to and follow the assigned task during any deployment. Volunteers should never go beyond what is tasked or asked of them. And if you have any questions or concerns about any tasks you've been given or roles or responsibilities assigned to you, please always contact your MRC point of contact for that specific deployment immediately to resolve any confusion or to clear up anything that you may need clarification on. Next, I'm going to discuss a little bit about medical authority. So essentially, when you're working in these EMS and medical tents, there will be our own MRC medical lead on site, but also there will be a medical authority who will then identify themselves. And that is essentially who you will be working under as a clinician. If you have any immediate concerns or questions, your medical authority is the person that you report to. Now, on the largest scale of medical authority, for my clinical volunteers, when you are in the field and deploying as a volunteer with the Philadelphia MRC unit, you are actively covered under the clinical and medical license of the acting health commissioner. And that is also why it's very essential and important for you to only act within your scope of practice and to not go out of anything that you have been tasked or assigned to do, because then those liability coverages that I mentioned a few slides before will not apply to you. All volunteers must follow instructions, role assignments, and assigned tasks. Again, if you have any questions about that, please contact us, or at the beginning of your just-in-time training, you can always feel free to ask those questions. Now we're going to cover some quick do's and don'ts. So volunteers are only permitted to deploy once they receive their deployment summary. And that is something I mentioned earlier during the volunteer deployment process. That deployment summary is essentially stating, we saw that you expressed interest in this specific volunteer opportunity, and we are selecting you to deploy to this volunteer opportunity. For example, if you express interest in quite a few different volunteer opportunities, such as Made in America, the Broad Street Run, or the flu clinics, but you only received a deployment summary from us about your assignment at a flu clinic, that means that is the only deployment that you were either selected for or clearly confirmed to be in attendance for. So if you sign up for multiple things and you only receive a deployment summary for one or two things, that is okay. You can always reach out to us to see if that was an error or if that was a conscious decision. We do staff our volunteers based on a first come, first served basis. And so deployment summaries are the way that we can ensure volunteers know, in fact, that they were selected to deploy. And we do also always ask for confirmation back in response to that deployment summaries that we know you accept that deployment. So please do not deploy in the field or to any volunteer deployment location without receiving that initial deployment summary. Next, volunteers must email to confirm if they accept a deployment. As I mentioned previously, you will receive a deployment summary in its official capacity as an email. We do require a response to that deployment summary, and this is for accountability purposes, so we know who to staff, how many people to staff, and so that we can also provide lists of the volunteers we have staffed to our partners, whether it's PFD or whether it's PPD in terms of security clearances and security checkpoints and making sure you get all your credentials and things like that. So it is very essential and important for all MRC volunteers to confirm once they accept a deployment. And then lastly, for the do's, if you are feeling ill in any way, please stay home. We do understand sometimes you wake up and you just may not feel 100%. That is okay. The health and safety of our volunteers is our utmost priority. And so please always feel free to just let us know if you are feeling ill that day and you are not able to make it. For the don'ts, in conjunction with receiving your deployment summary, as I mentioned earlier, if you do not receive that deployment summary, you are not in fact deployed. So please never self-deploy, never self-deploy. I will say that once more, never self-deploy. And essentially self-deploying is, let's say if you received a volunteer survey that said that we had 3 large-scale events coming up. You signed up for all 3 of them, but you had not received a deployment summary for one of them or for any of them, or you never received a deployment summary, or you never even confirmed that you accepted that deployment and you just showed up. That would essentially be the definition of self-deploying. Self-deploying is when you have not received that official deployment summary from us notifying you that you have been selected for that specific deployment, and then you just show up. Any volunteer who self-deploys will be sent home. Again, this is for accountability purposes. If it's an event such as Made in America, unfortunately, we cannot just have volunteers self-deploy, because at that point we have not yet secured any credentials or security passes for you. And then also no show, no call. Please do not no show, no call. We do understand that things happen, real world emergencies and life events do kind of get in our way from time to time. We understand and we're flexible, but please just notify us and just don't simply not show up. Again, if you are sick, or like I said, if something happens the day of the deployment or even before, please notify us as soon as possible so that we can make arrangements either to replace you with another volunteer or any other arrangements that need to be made. And lastly, do not act outside your scope of practice. I've covered this in the last slide, so I'm not going to dive too much into this, but this is important. It is very important to keep in mind that you are only covered under the liability clause as long as you stay within the realm of your scope of practice and you do not do anything outside of the assigned tasks. And just to show you how much MRC volunteers really do for the city of Philadelphia in terms of saving the city of Philadelphia over $500,000 in workforce funds. And that is something that every volunteer should be proud of. It's something I'm certainly proud of. We've done a lot of things in the past 2 ongoing years, especially since COVID hit in 2020, that I felt needed to be highlighted, such as, I don't know if any of you recall, the first ever drive-through testing location for COVID-19 was held in South Philadelphia at the Citizens Bank Park, and that was staffed, I want to say, at least by 80% by MRC volunteers. We ran one of the only isolation and quarantine sites in Philadelphia at the time during the height of COVID-19 for about 4 months, and that's still one of our longest deployments to date. We've done canvassing, vaccinating. If any of you recall, in the news headlines almost 2 years ago, there was an Operation Allies Welcome response where over 25,000 Afghan refugees and evacuees came through the Philadelphia International Airport seeking refuge and asylum. And we had volunteers on site for 13 consecutive days for 24 hours, providing staff and support from interpretation to screening and triage, even line staff as well. And then of course, how can we forget, again, with COVID, there was a large push for the city of Philadelphia to just disseminate a lot of testing kits. So we did that 1 year as well. And all in all, as I mentioned, and just some of these deployments and special event responses that we've done, we've saved the city of Philadelphia over $500,000 in workforce funds. Thank you so much for your time and your attention. We appreciate your volunteerism, and we appreciate you dedicating your time and services to volunteer with the Philadelphia Medical Reserve Corps. As always, please feel free to contact us with any questions, concerns, or for any additional information or anything that you may need clarification on. Here we have listed the CERPA website where you can go to register and update your CERPA profile. Under that is my personal contact information where you can feel free to text and or call me if you have any questions, concerns, or anything that you would like to vocalize. Followed by that, we have our email address where you can email us. We'll email you with any volunteer or deployment opportunities that will be made available to you. And then lastly, we do like to showcase a lot of the wonderful work our volunteers do on our Philadelphia Medical Reserve Corps LinkedIn page. We hope this was helpful and informative for you. We hope to see you in the field working alongside us sometime soon. And thank you so much for your interest in becoming a Philadelphia Medical Reserve Corps volunteer. Take care.